So here we're going to look at a technique for hip internal rotation. So hip adduction, internal rotation, and potentially a bit of hip flexion if you want to build that into it. And we use this for some of our groin issues, some of our sportsman's hernia type of issues, but we often use it for changing timing or movement patterns with our rotation-based sport. So it might be our golfers, if they're having trouble coming through onto that front internally rotating front leg, we can bring this pelvis through onto that rotating leg. We might be coming up onto the ribs a little more to bring the trunk through a little bit more, perhaps with some of our throwing or hitting type sports as well. So there's lots of opportunity with this one. You can in fact make it bilateral for some of our pubic symphysis patients as well, and we'll mention that as well. So basically we need to get the person in that short position once again. So we're going to bring them into internal rotation. So if you step into internal rotation, Aaron, and the key is to get this opposite hip forward so we maximally internally rotate. And then it's a spiral that's going to come around that thigh. So we're going to start on the outside and then nice anchor point here, get your tension on and then sweep through between the legs, keep your tension on as we come around, and then we've got to come across the front of the hip joint. Again, make sure they've stayed in that short position. We're going to come across the front of the hip and then lock off onto the contralateral pelvis. So now as they do go to externally rotate or extend or open up through the pelvis, this is going to stretch and it basically brings the other side of the pelvis forward at the same time as their left leg now. If you wanted to assist the abdominals, maybe they have an abdominal strain or you want to focus on that part of the movement, moving the trunk through a little sooner, then what you can do is actually as you come forward, bring them into flexion and rotation and just continue up and around onto the ribs and finish onto the back. And that way we'll be dragging the trunk forward sooner with this, or we'll be resisting them going into trunk extension rotation to the right, so helping that eccentric abdominal action and then bringing them back forward. If you do want to do it bilaterally for say our pubic symphysis, you can carry this on around the pelvis and keep going all the way around to get that strong force closure. And then once you get to this point, you swap legs and you put now the right leg into that internally rotated position. So if you step through, Aaron, turn that one in and pull this hip forward, and we would carry on the tape around, so it's going to cross over that pubic symphysis and around to finish down here, so that again it's pulling into that internally rotated position. And that can be very nice for some of those anterior pelvic girdle pain subjects.